In this video, we're going to cover quite a few topics under the general title of containers for parenterals. We're going to see what types of parenterals there are according to their volume, the criteria we should consider when determining the most suitable material to use in the manufacture of our container, the types of materials that we can use, and finally, we'll delve into details on rubber closures. If we wanted to categorize the types of parenterals based on the volume of product that can be held by the container, then we can categorize them into small volume parenterals and large volume parenterals. Small volume parenterals are packaged into containers carrying no more than 100 milliliters of parenteral product. A common example is insulin preparations, and they can come in many forms, such as insulin pumps, insulin needles, and insulin pen devices, as we can see in this diagram here. On the other hand, large volume parenterals are packaged into containers carrying more than 100 milliliters of parenteral product. They are single-dose aqueous solutions administered intravenously via infusion bags, the aim being to replenish body fluids and electrolytes or to deliver nutrition, as with total parenteral nutrition for comatose patients. These parenterals contain no extra additives and must be pyrogen-free. They can be used for maintenance therapy, replacement therapy, irrigation solutions, and dialysis solutions. In general, we know that we can package parenteral products into vials, ampoules, syringes, and infusion bags. But based on what criteria do we decide it's most suitable to use one type of container over the other? Well, based on a lot of things, such as product stability, compatibility with contents, and what I mean by this is that the container should not interact in any way with the parenteral product or excipients. Resistance to breakage and leakage, protection against light and moisture, resistance against microorganisms, and resistance to temperature differences. It should ideally be transparent, especially if we're making powders for reconstitution, and it should be easy to be used by physicians, pharmacists, and patients. And of course, it goes without saying that all of these criteria would be useless if it was not FDA approved. So, let's say we've decided on our container. For example, we're going to package the parenteral product in a vial. What type of material can the vial be made up of? There are many materials, but the two most common and the ones we'll be discussing in this video are glass containers and plastic containers. Beginning with glass containers, they have many advantages, and as such, they are the most preferred material to manufacture pharmaceutical primary packaging. They are durable, and they are fairly inert to parenteral products. The reality is that glass isn't totally inert. It's inert to a certain degree. Glass is primarily composed of silicon dioxide and many other oxides which are alkalis. While silicon dioxide is the major backbone of glass alongside boric oxide, the other oxides are loosely held to the structure and hence are free to migrate and leach out of the glass and into the container contents. So that's why we say that glass is fairly inert, but not totally inert. Oftentimes, glass containers are transparent, which allows for easy inspection of container contents. They are sustainable and eco-friendly because they are 100% recyclable, and they are versatile in design, meaning we can customize the glass container depending on what shape and size we want it to be. However, glass containers do have their disadvantages. They are fragile, expensive in comparison to plastic, and they have high transportation costs. They may crack when subjected to sudden temperature changes, and certain types of glass release alkali into container contents, as we will see later on. We can subdivide glass into four main types: Type 1, Type 2, Type 3, and Type non-parenteral or NP. And this type is not used for parenterals, it is used for the packaging of oral and topical products, so we won't be talking about this type of glass in this video. Right now, we are more concerned with these three types of glasses. This division came about due to the differences in hydrolytic resistance of each type of glass. That is to say, when glass makes contact with water, it releases alkali ions into the water, and the ability to resist this was measured to give us these three different types of glass containers. Let's start with type 1 glass containers. They are considered the highest grade of pharmaceutical glass and are mainly made of silicon and boron, hence the name borosilicate. They are neutral, meaning that they are chemically stable, and therefore we can package any type of drug formulation in them, whether the drug solutions are acidic, alkaline, or neutral, or whether they're parenterals or non-parenterals. They have a high hydrolytic resistance, and in fact, they are the most inert type of glass, meaning that the likelihood of leaching of glass components into water happening is very low. Type 2 glass containers are made of soda-lime silica glass. They are also known as dealkalinized glass, as their inner layer is treated with sulfur dioxide, which reacts with other oxides found on the glass surface to form products that can easily be washed off the container before placing the parenteral product inside it. In this way, treatment with sulfur dioxide increases the hydrolytic resistance and therefore decreases the chances of leaching from happening. We can package most acidic and neutral aqueous preparations into this type of glass. Type 3 glass containers are also made of soda-lime silica glass, but the difference between type 3 and type 2 glass containers is that type 3 glass containers are not treated with sulfur dioxide, and hence it has moderate hydrolytic resistance with a possibility of some leaching of glass components occurring. That is why, if we were to use this type of glass, we would not opt to package aqueous preparations inside. Instead, we can package non-aqueous parenteral preparations, powders for parenteral use, provided that they are not freeze-dried, and also non-parenterals. To summarize this part, I want you to notice some things. First of all, glass containers are produced either from borosilicate glass, as with type 1, or soda-lime silica glass, as with types 2 and 3. Second, glass containers can either be treated, as with type 2, or untreated, as with types 1 and 3. Third, type 1 glass containers have a high hydrolytic resistance due to the chemical composition of the glass itself, type 2 because it is treated with sulfur dioxide, and type 3 has a moderate hydrolytic resistance as it is untreated. Lastly, all types of glass can be used either for parenterals or non-parenterals. The next type of material is plastics. Plastics are versatile materials that we most commonly use in parenterals to manufacture syringes and infusion bags providing nutrition to patients. They are flexible and non-breakable, cheaper to manufacture than glass and take up less storage space than glass, and they also have lower transportation costs. They are lighter in weight and easier to handle than glass containers. However, they cannot withstand high temperatures, they may change the color of the parenteral product, and they are not chemically inert. And this is because the additives added to plastic containers may enter a chemical reaction with the drug product, altering the product's quality. Plastics are essentially made of polymers. There are several polymers that can be used in the manufacture of plastics, some being polyethylene, polypropylene, polyvinyl chloride, polystyrene, and nylon. But we're going to talk about these three types of polymers in more details. I want you to notice a couple of things here. First, polyethylene and polypropylene have no plasticizers added onto them, whereas polyvinyl chloride has a plasticizer, phthalate ester, added onto it. In general, plasticizers are added to enhance the flexibility of the plastic, meaning that when we come to choose a plastic to manufacture IV tubing administration sets, we would choose plastics with polyvinyl chloride as they are more flexible than plastics with polyethylene and polypropylene. All of these polymers are autoclavable, meaning they can easily be sterilized. So, we finished talking about containers, but what about the closures placed on top of them? Closures can be made of many materials like containers, but in this video, we're going to focus on rubber closures. Another name for rubber closures is rubber stoppers, and you'll find me using these two terms interchangeably in this video. Right, what is rubber composed of? Any basic rubber is composed of an elastomer polymer with the addition of certain additives, and these additives will differ depending on the properties we want the rubber stopper to possess. Let's break this down further. Elastomers are polymers which can be stretched, and once the force is removed, they return to their original length. We can use saturated elastomers, unsaturated elastomers, or a combination of both types of elastomers as the main backbone of the rubber stopper. As for the additives, we can add accelerators, activators, plasticizers, pigments, or vulcanizing agents. And for this video, the details of each additive isn't important to know. Now that we've finished talking about the basic composition of rubber stoppers, it's important for us to understand the physical properties of rubber so that we can manufacture high-quality rubber stoppers which won't cause us problems once we begin to use them. Let's begin with coring. Coring is when a small piece of rubber is cut out of the stopper as the needle is inserted into it. This small piece of rubber ends up entering the sterile dosage form when the needle is inserted to draw out the medication, or when air is injected into it before withdrawing the medication, thereby contaminating the sterile contents. In this diagram, we can see the small piece of rubber that was cored into the vial as the needle punctured it. And if we were to draw the contents of the vial, there is a huge risk of the rubber piece being taken along with the vial contents, as we can see in this diagram here, and being injected into the patient's bloodstream, which is undesirable and can cause adverse effects. Coring can occur when the needle inserts a rubber stopper of poor quality, when the needle is inserted in the wrong angle or by exerting great pressure, and when the same rubber stopper is repeatedly punctured. Coring can occur over time. What's so dangerous and risky about this is that the piece of rubber torn out is oftentimes so small that it's difficult to actually know whether coring occurred or not by inspecting it with the naked eye. We often know when, God forbid, the piece enters the patient's circulation and causes adverse effects. But if enough caution is taken during inspection of the syringes and by changing the angle of penetration, then this incident can largely be avoided. If the piece of rubber could also float and were noticeable in color, such as red for example, then the incidence of coring would also be easier to spot. Resealability. Rubber stoppers must reseal to prevent any risk of contamination and leakage of the contents inside. Puncture resistance. Puncture resistance is a measure of how resistant the rubber stopper material is to being punctured by the needle without being damaged or allowing contaminants to enter the sterile vial contents. And we have a very lovely demonstration of that right here. When manufacturing rubber stoppers, we need to consider what the sterile dosage form will be used for. For example, if we were to inject pediatrics, we would use a thin needle, and as such, the puncture resistance of rubber must be low to allow for easy and efficient penetration of the needle through the rubber material. Similarly, the rubber stoppers would need to have a higher puncture resistance if thick needles are to be used instead. Hardness. From its name, hardness is simply how soft or firm the rubber material of the stopper is. More precisely, it is a measure of how resistant the rubber stopper material is to deformation, and we can use a durometer to measure it. This is what the durometer device looks like. In order for us to test the hardness of the rubber material, the durometer is pressed down on the rubber and the indentation depth created by the indenter is measured, as we can see in this demonstration right here. A high durometer value indicates a hard rubber stopper, while a low value indicates a soft and flexible rubber stopper. If we obtain a high durometer value, this can tell us a couple of things about other properties of the rubber. A high durometer value tells us that the likelihood of coring happening is increased, the resealability is decreased, and the puncture resistance is increased, all of which occur as the rubber is more rigid and less flexible, and therefore these are all unfavorable properties for rubber stoppers. Compression set. Compression set is the ability of the rubber stopper material to recover and return to its original thickness and shape after being compressed for a certain period of time at a specific temperature. Similarly, we can also define compression set as the degree of deformation the rubber stopper acquires after compression. If we take a look at this diagram here, we can see that the rubber maintains a certain shape before compressing it, but when we apply a certain load to it and then remove that load after a certain period of time has passed, the degree of deformation can vary depending on the compression set of the rubber material. If it has a high compression set, that would mean the rubber completely loses its shape after compression, which is unfavorable as it might allow for leakage of the vial contents. On the other hand, a low compression set would mean that the rubber, to some degree, returns to its original shape and thickness after compression, which is favorable. Rubber stoppers should ideally have a good recovery after compression to ensure good sealing characteristics and hence avoid leakage. Moisture vapor transmission. It is the rubber stopper's ability to absorb water vapor from the surrounding environment. It's basically the amount of water vapor that the rubber stopper can absorb from its environment, and its ability to do so is inversely proportional to its thickness. A thick rubber stopper will allow little water through it, and vice versa. Since rubber is naturally porous, a small amount of water absorption is normal and to be expected. However, we need to be careful about how much water is allowed across the stopper, as this water can cause degradation to the parenteral product, especially if it's prone to hydrolysis, hence ruining the entire preparation. Lastly, tackiness. Tackiness is the adhesive, sticky property of the rubber stopper, and it usually comes about when the rubber stoppers are heated during the sterilization process. We don't want the rubber stoppers to be too sticky or else they'll clump up, making their processing and handling a more strenuous and demanding procedure. The last thing we're going to talk about in this video is what kinds of compatibility issues can come up when using a rubber stopper. Quite simply, there are two possible types of interactions between the rubber stopper and the parenteral product. Either the rubber stopper affects the product, or the parenteral product affects the rubber stopper. What does this even mean? Let's take a look at the first type of interaction. The rubber stopper affects the product. The rubber stopper has the ability, when in contact with the parenteral solution, to absorb certain ingredients from the solution, thereby removing these ingredients from the parenteral product. This is called sorption and is especially problematic if it occurs in multiple-use containers. Likewise, the product can affect the rubber stopper. Certain ingredients from the rubber stopper can leave and leach into the parenteral solution, in turn reacting with the solution and hence ruining the preparation. And here is a diagram to demonstrate these two compatibility issues. And that will be all for this video.